Good morning, everybody, and welcome to Brain Turns. I have the honor today of introducing our CEO of Northwell and our leader, Michael Dowling, who affectionately really is known as Michael. Before I introduce Michael, I am extremely proud of this Brain Turns course and the span and the robust nature of what's being communicated as part of this course. I'm extremely proud of our neurosurgical department that has really been built up over the past several years and now making it into, if I can brag for them, the top 50 in the US News and World Report, something we're extremely proud of. I'm very lucky to have an opportunity to speak to you more formally next week, which I will, but today I'm just introducing Michael for a moment. And the way I will, it's really my honor, and Michael today I hope is going to talk somewhat about his career and his vision and get questions from Dr. Langer, but I came to Northwell, it's 6 years ago now, and I'm a cardiologist and I started in administration 6 years ago here. And, you know, when you start reading about the health system and reading about Michael Dowling, everybody speaks as Michael as a visionary. And I always feel that that word is so used so frequently and you kind of shrug it off for a moment. And then when I was interviewing here and I sat down with Michael and I walked out of that room and I'm like, wow, he actually is a visionary. And it absolutely is so. And that has been so through every part of my 6 years here at Northwell. To really have a visionary of healthcare is something that has been so important to me also as a leader in healthcare. And he has laid the foundation, the culture, and the relationships that always allow our clinical excellence to shine. And that has never been more important than in COVID. And while he was a visionary always, what happened during COVID was truly spectacular, and the way that Northwell and our hospitals have been able to perform. And again, that was really because of his vision and the way that he has created and built Northwell Health. So Michael, I personally thank you for leading us during COVID, leading us at Northwell, building this health system, and for my personal relationship with you. So I look forward to your talk today. And David, thank you for allowing me to introduce Michael. Thank you, Michael.
Thanks for being here, Jill. Jill will be joining us a week from Friday as part of the Chairman's Corner to discuss her own trajectory as a woman physician in medicine, moving from essentially a clinical cardiologist into a leadership role, chief medical officer, and then now running Lennox Hospital. So I think your trajectory also will be really interesting to the group. And so that's going to be a week from Friday on the 14th of August at the same a 10 o'clock time slot on Friday. So we look forward to seeing you back, Jill. Thanks for doing this. Appreciate it.
Thank you so much.
So I'd like Michael, you know, this is a pretty open-ended thing. I think, you know, your biography and your story is so sort of extraordinary that I really want you to, you know, opine primarily on what brought you to the United States, especially in this day and age with what's happened with immigration. Why did you choose to come here? What was in your heart that led you here? You could tell us a little about your family. I know your family story is exceptionally interesting. We have a wide range of students here from all parts of the world, basically. I'm sure they're out of the 1,200 kids that are on this right now, there's someone that probably come from a background that would benefit from hearing of what you've accomplished. And then I also promised them that you'd give them your book list. The groups asked us for names of books. I know you're, you know, a real lover of books and reading, and so I spoke to your office last night. So at the end, maybe you can give us our book list or give it to Joshua, and we'll get it to the team, and then explain your trajectory through the docs, the Fordham, to the Cuomo administration, how you ended up in healthcare. And you know, why don't you just start off with your how this all happened, then I'll ping you along the way. I wanted you to talk as much as possible.
Okay, David, thank you so much. And I'm delighted to have the opportunity to spend a few minutes. You guys do great work. And for you, David, I just want to congratulate you on and all your team for the spectacular work that you do. So let me begin. For everybody listening in, the tenet of my basic philosophy is that everything is possible. Nothing is impossible. So for people out there that are thinking about reaching for the stars, I would basically say just go to it and be committed. So as David asked, let me just give you a little bit of the story. I'm an immigrant, as you can probably tell by my accent. I grew up in Ireland, and I grew up in pretty serious poverty. My family was quite poor. I was the oldest. You know, my story in many ways is not too different from many others, but just to give you an idea, I mean, I grew up in a home in Ireland at that time in the 50s. In the 60s, we had no running water, we had no bathrooms, we had no heat, we had no electricity. My father was a very hard worker, but he unfortunately was crippled with arthritis at about the age of 40, so he could never work again. And my mother was deaf. So I was the oldest, and things were pretty bad at home. One of the things I always dreamed about was getting a college degree. I had only known one or two people with college degrees, mostly the local teacher. And I was always had a love of reading and books. And my mother, despite the poverty, my mother always made books available. And so as you read and as you get exposed to different viewpoints through reading, you get to see the world in a much broader way. Because where I grew up, at the time, there were no cars. You know, if you wanted to travel from my house back in those days, you had to walk, bicycle, or ride a donkey. So when I got to the age of 16 and a half, I ended up going to England to work in steel factories for two purposes. One is to help out my family at home because things were pretty bad, and then to try to figure out how it is I could get to college at some point. I did well enough in high school in Ireland that I became eligible to go to college, but I had no money. So I go back to England, I worked, but then I realized that you don't make as much money in England, and I had all these stories about New York. So I decided, what the heck, I will come to New York. So I came to New York, and I came here, I was almost 18, and I ended up working on the docks. And I got into college in Ireland. So for 3 years, I would spend 6 months, 7 months working on the docks here in New York. And then I would go back to Ireland and work on the boats. Well, I work in, go to college. And the other reason was I was a pretty good athlete. I played the Irish national sport, which is hurling, very physical sport. And, you know, I was able to get on all of the top teams. And so that was also a draw to go back as well as getting college. But when I finished college in Ireland, I decided to come back to New York. I never intended to stay in New York. It was a matter of coming back. I knew I could make some money here. I was helping out at home. And of course, as things turn out, I'm still here. I'm still the only person in New York. My whole family is still in Ireland. So when I came back to New York, I stayed working on the docks. Then I worked in construction. Then I went to Fordham at night. I got my master's degree at Fordham. I went on to Columbia to get my doctorate, which I did everything except hand in my final dissertation. And I never finished it, which I will tell you about in a second. And after I graduated Fordham, I was asked to teach some adjunct courses, which I did. Those went very well. So I was teaching courses at Fordham while working in construction and doing other types of jobs like cleaning out bars in the morning and that. And then they asked me to come back full-time to Fordham to teach full-time, which I did. I ended up becoming a full faculty member at Fordham. And I also ended up becoming the assistant dean of the graduate program at Lincoln Center, their graduate school of social service. They also had a campus in Westchester, which is north of New York. I ended up heading up that campus. And so I was at Fordham for quite a number of years. And I enjoyed the teaching, I enjoyed learning. I was finishing my doctorate. And then the governorship of the state of New York changed, and a guy named Mario Cuomo, he is the father of the current governor of the state of New York, got elected. I did not know him at all, had never met him. They obviously had noticed some of the things I was doing, which was a surprise to me at the time. So after he got elected, they reached out, asked if I would consider being interviewed for a job in state government. And initially I declined, but they kept coming back. And after 2 or 3 months, I finally said, you know, I'm a risk taker. I like to jump into new things, even though I'm not exactly sure what's going to happen. But I'm a big believer that when the door opens, you should walk through, because you never know what's going to be on the other side. So I got hired by the state, by the governor's office, as a deputy commissioner in Albany in the Department of Social Services. So I ended up working in Albany. I commuted from New York to Albany for about 4.5 years. While I was in that department, we did some very interesting things around job employment, welfare issues, and obviously became a little bit more noticed. I got to meet the governor a number of times during that period. I had not, as I said, knew him before I got in there. And then a number of years later, the governor called me and asked me if I would come to the governor's office. And I ended up becoming his director of health and human services for the state of New York, and deputy secretary to the governor, which is like deputy chief of staff. So I essentially became the person overseeing all health and human services for the state and the top advisor for the governor. I did that for 12 years. So I worked in government at that time during the AIDS epidemic in New York, during the homeless crisis, which of course still goes on a lot, the crack epidemic, the drug abuse, the deinstitutionalization of the mentally ill. I had my hands pretty much, or I was involved in a lot of those issues. It was a phenomenal experience. I still tell young people that if they have an opportunity to work in government for a period of time, they should, because you get to see the world through a different lens. There's a lot of criticism of government, and sometimes I'm critical of it. But when you're in government, you get to deal with issues that are so complex that most people who are not in government don't have a full understanding of the complexity. Because you end up getting to deal with stuff that other institutions in society can't deal with. So I was in government for that many years. The governor eventually left office. I ended up going in. I was fortunate at that time. I was offered a number of jobs. I ended up working with a big insurance company in New York as a senior exec, and I didn't like it that much. But while I was there, I got recruited to come to North Shore Hospital by the CEO of North Shore Hospital at that time. Now, when I was in government, I had responsibility for overall healthcare in the state. And at the time, I was working on figuring out how do you create large health systems, because I was familiar with what happened in the western part of the United States. Places like Kaiser Permanente, which some people in the audience may be familiar with. These are large integrated systems with multiple components rather than the singular hospital idea that existed in New York. So when I was hired at North Shore, they had begun to talk about creating a health system. They actually had added 1 or 2 hospitals. And I came in, we started to increase the healthcare system. I came in as chief operating officer. So we started to grow the health system and take a number of hospitals in the region and bring them together as part of one entity, so that it became the essence of the beginning of a system. That continued for quite a number of years. We had some very, very big mergers. The big merger was in 1996, 97, when 2 large tertiary campuses, Long Island Jewish and North Shore, came together. Very complicated merger, by the way. And we were actually challenged by the United States Justice Department to prevent us from merging. We had a 2-week court trial. We won. And then that set us to, when that happened, that merger occurred, we continued to grow. After 5 years as chief operating officer, I became the CEO. So I've been the CEO now for 22, 23 years. And we continue to expand. We now have, as part of Northwell, and David, I can go into any part of this that you wish. We are now the largest primary care entity in New York, with the largest hospital system in New York, with the largest ambulatory care system in New York. We have all components of the delivery system, everything from primary care to end of life. We are one of the largest academic teaching places in the United States. We are a major research entity. We have a major research facility called the Feinstein. So we're a fully integrated system with 23 hospitals today, about 800 ambulatory sites, nursing homes, post-acute services, home care, etc. We have a major transport network. We are the most comprehensive, most integrated, and largest health system in New York. A number of years ago, 10 years ago, we moved into Manhattan. We were not in Manhattan at the beginning. We were out on Long Island and in the surrounding area, but we were not in Manhattan. We took a chance in taking over Lennox Hospital in Manhattan. And for those of people who know New York is a very competitive place. You've got to have a real competitive instinct if you're going to succeed in New York. You've got lots of high-powered entities here. We took over Lennox Hill. It was not in very good shape, and we took it over, to put it mildly. We've continued to grow it, expand it, and with people like David and his team, we are now ranked one of the top places, and we have added about 95 other locations in Manhattan. So we have a very interesting culture in the organization. It's very team-based, very collaborative. I'm a big, big believer that if you get the right people around you and you hire the right people, recruit the right people. And what I mean by right people is people with a positive attitude, people who want to collaborate, people who are team-oriented, people who are looking forward, not backward, people who see the status quo as the big competitor, but people who want to change, who are transformative, who want to think differently, who challenge. But when decisions are made, they act as a team. You want people that help one another. So we spend a lot of time doing this over the years. And today we're in a pretty good position. Obviously, you'll never completely succeed. You're never as successful as you'd like to be. You're always chasing success. I mean, the danger, and that's just as true as an individual and not just as an organization, but the danger always is believing your own press releases. You know, was believing that you are great and you are perfect and you can't improve. That's the beginning of going downhill. It's the same with an organization. If you think you're great and you think you've reached the pinnacle of power and influence, then you're beginning to slide back. Complacency is dangerous. So you've got to continue to be pushing. And that's what we try to do here. And I think it's a lesson for everybody. And even with my own story as an immigrant, which is not, as I said at the beginning, not too different from many others, I'm always pushing to get better, always pushing to do something different. I don't like to relax. I get crazy when I relax. You know, you try to push yourself. And I always remember if I had taken the position of jumping to anything when I was 16 or leaving home, whether this was the time before computers, before telephones, we had no telephone in Ireland at the time. And if you were afraid to take those jumps, there is something in that. And never move forward backwards. Still be. Well, who knows where I would be, but you know, people who stayed back in the old neighborhood where I grew up in are, you know, they're still there. Some of them, you know, they get up in the morning, they milk some cows, and it was a farming area. I didn't grow up in the city. I grew up in a farming area. So this constant move forward and this constant having high expectations is very, 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 very important. So that's a little bit of the story. We're pretty fortunate today, and I think the essence of how Northwell works became very, very evident during COVID. And David, I can talk a little bit about COVID if you wish. I mean, as you probably, many of you have been following, you know, New York became, for the United States, the epicenter of the COVID experience at the beginning. And we were at the epicenter of the epicenter. Because of our locations, we ended up getting our first COVID case at the beginning of March. And it grew very, very slowly up until towards the end of March. And in the first week of April, it exploded. We went from a couple of hundred cases in our whole health system at the beginning of April to 3,500 inpatient hospital-based patients by October 6th and 7th. Every single one of our hospitals had to be pretty much converted to be almost completely, totally COVID. we ended up in total treating over 70,000 COVID patients. That's if you include the ambulatory with the inpatient. On the inpatient side, we treated over 17,000 COVID patients, which means that we had to completely convert our whole health system. We had to shut down all of our ambulatory facilities, all of our ambulatory surgery. And the big issues around COVID were, how do you find the staff to take care of these very, very, very sick people in critical condition, especially in the ICU, where you get the PPE and the supplies. And we were able to do this pretty well because we have our own purchasing organization, we have our own warehouse, we have our own distribution center. We were able to load balance during COVID. What I mean by that is that when one hospital got very, very busy, because we have our own transport network and because of the way our culture works, we were able to move people from one hospital to another hospital. So we were moving 50, 60 patients a day between hospitals so that no one place could get completely overloaded. We had to have a very, very sophisticated, clinical advisory group during COVID because how we treated the disease changed constantly. So you needed to develop, ongoing guidelines about clinical protocols. And we did a lot of research, treatment research during COVID. So we handled it quite well, I believe. We also were very, very instrumental in coordinating the response to COVID for the whole region, because I have a very close working relationship with the current governor, who is, as I said earlier, he is the son of the governor that I worked with for years and years. So I have known him a long time. So he and I were constantly in contact, many times on a daily basis. I did many of the press conferences with him during the COVID crisis. And so I'm still working with him very, very closely. Right now, we have very few COVID patients. We're now trying to recover, bring the business back that we had closed down. And that's a slow, tedious, complicated process, but it's working pretty well. And of course, we have put in place very, very detailed plans in case we do get an upsurge of COVID in the fall or in the early of next year. So we know what those plans are. We know what to do. We don't get overly stressed out here. We're pretty calm during a crisis. And when you're in a crisis, the key thing to be is positive, upbeat, can-do attitude. Leadership cannot get overly flustered in the crisis, because then everybody around you gets flustered. You have to have a positive countenance. And I'm a strong believer that a lot of things happen to you in life, and it's how you react to those things that happen to you that makes a difference. It's not the challenge itself, it's how you react to the challenge. And we all go through these things. And in healthcare especially, if you think of it, healthcare is a wonderful, wonderful profession. What we do every day is we take care of people in trouble. We help try to prevent the trouble up front, but then when they're in trouble, we take care of them. So we deal with crisis on an ongoing basis. So when a crisis happens like a pandemic, it's just a much bigger thing that happens all at once, or it escalates very, very quickly. And it's just another acceleration of what it is we do each and every day. And I think healthcare workers are uniquely able to do this. And I can say that being, through the COVID crisis, and I was out in the hospitals on an ongoing basis almost every day, and the dedication and the courage and the compassion displayed by the staff at every level, from physicians to nurses to respiratory therapists to the environmental workers, the cleaning people, the transport people, was absolutely extraordinary. And if you wanted to see unity in action, if you wanted to see people come together as part of a team, we all came together because we're fighting this invisible enemy. And it demonstrated that large systems like ours, when they're put together the right way, when they have the right culture, are uniquely equipped to deal with a crisis like COVID that we've gone through over the last couple of months. So it's been an interesting journey. I had visions at one time of getting a college degree. Being where I am today and being able to work with just great people in the organization is a wonderful privilege for me. But for anybody listening out there, anybody that's looking to see and think about what should I do in the future, I would say to you, just raise the bar, have a lot of confidence, not ego, confidence, and keep a little bit of humility about you. Understand that you can be very, very successful, but if you focus the right way, but also making sure that you keep your feet on the ground. People respect people that are real human beings. We all may have different titles. We all may be in different positions, but at the end of the day, there's a commonality among us that is very, very important. And you just don't make yourself get a little bit too big and lose respect for people around you. That's not the way you become successful, in my view. But David, let me stop here. I don't want to just continue to ramble on here and not have it as relevant. You're on mute, David.
We have so many good questions. I'm going to let Josh handle that. I just have one question myself, and I'll turn it over to Josh. Literally, the quality of these questions is just unbelievable. And so Josh will pick a few of them. The question I have, and reading a lot, we've emphasized in addition to the healthcare thing in this project, leadership. We've talked a lot about leadership, and one of the we had a woman named Pamela Park from Berkeley on last week, who talked about she's identified two kinds of leadership: Gold Star and North Star leadership. And Gold Star leaders basically make incremental progress. They get their degrees, they teach a course, they meet somebody, they get promoted, there's that Gold Star process that you obviously went through. But a North Star leader is someone who has a vision, puts a team around him, or her for that matter, and creates something out of nothing. A typical Gold Star leader is an Elon Musk or a Steve Jobs, where the classic Gold Star leader is a bank executive who's moved up the food chain. We talked a lot about that there's Gold Star and North Star in healthcare. In fact, your story, listening to it, is really reflective of that. When did you recognize the first I heard of this was when the large health systems, and this feeds into some of our questions. Did you realize what you were capable of accomplishing, or did you have an idea then of what you wanted to do? Was it something that was a little more incremental? And how did you gather the team around you to buy into your vision? What were the key steps, the key moments, and when did you know this was going to work? And when did you feel that tailwind for the first time? And then I'll turn it over to Josh.
Yeah. Well, let me go back a little bit. There are these moments in life when you begin to get a little bit of confidence in yourself. And as again, I said, not necessarily big ego, but confidence. And when I was in college in Ireland, I became very, very involved in student politics. I've always wanted to be involved. I've always wanted to be at the table. So when I went to college, I was there as a very, very poor kid, wearing poor clothes, etc. But I was good at sports, and I became a very, very good athlete. And that gives you a confidence, when you're on the playing field, status, income, wherever you grow up in society, didn't matter. You're kind of all equal on the playing field, and I happen to be pretty good at it. That gives you a lot of confidence. When I at college, then I became very involved in student politics. And I got to tell you, when you become a student leader in a college, that is great training ground, by the way, because there's nothing worse than a group of students when they go after you. And you've got to be able to sustain that. So when I was in government, I had read an awful lot about healthcare around the world. And obviously I was very, very much involved in it. And I understood that the way the world was changing, that the idea of individual hospitals, every little unit of the delivery system, were not working together, not being combined, not being integrated, was not sustainable in the long run. It was not the way the world was going to evolve, especially as technology and data information became much, much more available. And also, if you look at it from the perspective of the patient, in Ireland, my father had serious health problems, and every time he intersected with one piece of the healthcare system, it was totally unconnected to the next piece. So all of these things percolate in your mind. So when I came to North Shore Hospital, it was an opportunity to put a lot of this stuff in place, is to think about how would you create something that is different. And I didn't want to bring a lot of entities together just to be able to say that I have a lot of entities and I'm just large. I wanted to be able to figure out how to do it differently, which means that you integrate the components. And while we started out as a hospital system, we have eventually evolved so that after we did, going to your question, after we did a couple of the first mergers, and they were difficult because people didn't want to merge. They were very captive in their own little areas, in their own silos, and they had a lot of history, these individual places. But when you broke through that, and you brought the right people together, and to me, it's all about having the right people in the room. And 2 hospitals begin to work together, and 3 hospitals begin to work together. I believe, oh, this is possible. These places can work together if you keep pushing it and you put the right people in place. And then the expansion just grew. I mean, it just happened. But then the big realization was after we did the merger between these 2 big tertiary campuses, it hit you that if you could make that happen, these 2 places that were bitter enemies for 50 years, fought every day, hated each other, that if you could bring them together and make it work, then everything was possible. And then the other light bulb was, of course, that healthcare was moving ambulatory and that you couldn't be focused only on hospitals. You had to make sure that you had the full constellation of services so you could do your best to try to integrate them. And I don't think, despite what we've developed and what we've done, I don't believe we're anywhere close to being as good as we can be. Because every day is a learning experience. And by the way, the COVID experience taught us something. I mean, people, even however, despite the fact that we all worked together, it was amazing during COVID that people who never worked together before were forced to work together during COVID. So the integration was facilitated by treating the COVID epidemic. And therefore, I think our hospitals and our facilities are different places today than they were pre-COVID, because I would think we learned valuable lessons from COVID. So I think it's an evolution. But leadership, David, I just end with this. The best definition of leadership that I've ever come across was that leadership is about managing the present. It's about selectively forgetting the past. And it's about creating the future. So we are where we are today. The issue for all of us in leadership positions, and to me, I define leadership at every level of the organization. It's just not in the C-suite. The department chair is a leader. The supervisor on the floor is a leader. The question now is, where do we go from here? How do we take the learnings after all these years, and how do we create something for the future that is so much better for the patient and for the community? It's not about being better for us. Is it better for the community? Is it better for the customer, which is the patient? That's the big question, I believe, for us going forward. So again, we're in a good place. We are nowhere near where we can be, though.
Well, that's great, Michael. I'll turn over to Josh. We're about over 1,600 participants right now with almost as many questions. So Josh, take it away.
Yeah. Thank you so much for giving your story and offering up your time to speak with us. A lot of people are interested in your background and how it's affected you. So people would like to know, what would you recommend to people who want to pursue a career in healthcare, but they're coming from a lower socioeconomic background and feel they cannot do it because oftentimes time and money are factors that deter people from choosing medicine or other careers related to healthcare?
I would say, don't ever give up your dream. Take a long view. You may not be able to do it today, but begin doing something in the area. You can, when you get into healthcare, you can volunteer. You can start out at a low level. But I don't think there is anything to prevent people from actually wanting to get in. You can get into healthcare. And as I did, I was involved in healthcare when I was doing a lot of other non-healthcare jobs at the beginning. And I was working in construction and I was involved in healthcare. I was working in the docks and I was involved in healthcare. So I would say to people, be visionary in your thinking, but be incremental in how you want to go about it. Keep the goal in mind. Don't give up, and be very dedicated to raising the bar all the time. So I would say confidence is important, and just keep working toward it. Don't give up.
People are also interested in how you avoided burning out while getting your higher education and continuing to work towards accomplishing your goals, especially being away from your family.
Well, I'm a workaholic. I love to work. I enjoy work. And to me, it's not work; it's what I do. Burnout. I've never had a feeling that I was going to burn out. I mean, at all. Sometimes, quite to be honest about it, I have a hard time understanding it because to me, the busier I am, the better I am. And I don't stress out too much. I mean, I don't get frantic. I'm when things get really bad, I get pretty calm. Being away from my family, at the beginning, it was difficult. But I was always, I was helping out my family. I was sending money home every 2 weeks. The happiest moments of my life was when I was putting money in an envelope to mail home. The most difficult part of it at the beginning was there were no phones. I mean, people today are so used to having the iPhone with them every minute, and they're always in communication. But when I came to the United States at the beginning, there was no way to communicate with home. I was here a month before my mother knew that I actually had arrived safely, because there was no phones in Ireland. I had no phone. I get here, I write a letter. The letter took 2 weeks that time to get to her home in Ireland, out in the country. So she gets the letter, then she writes back another 2 weeks. So it was a month before I knew that she knew that I had arrived. That was a little awkward, but then times were different. And it's important to keep in mind that no matter how impoverished you think you are today, or how poor you are today, you're so much better off than what people were 30, 40, 50 years ago. So you got to keep it in perspective. So today people get frustrated if they call somebody, they don't pick up the phone right away. Or people get frustrated to go on their computer and it takes 30 seconds for it to start. They get frustrated. You got to put it in perspective. So for me, yeah, being away from home back then was hard. Today, Ireland is 5 hours away. We can Skype. I can be on the phone any moment. So look what we're doing here. I mean, we're talking to people from all over the world. It's a whole different world today than it was back then.
Michael, I want to jump in for a minute. Thanks, Josh. He's going to compile a few more questions.
Sure.
You've obviously gone across many different careers, many different professions. Going from working on the docks to now, running the largest hospital system in New York. I guess my question is, what underlying theme do you see? What does this say about you as you've gone through? You've been a teacher, you've led companies, you obviously lead this now. What's the underarching theme of kind of who you are that you pull from this and your contribution?
Well, first of all, I love a challenge, by the way. I just love challenge. I mean, and I actually, sometimes I don't use the word challenge that much. It's all about opportunity. So I love to learn. And so whatever I'm involved in, I love to try to get as much information about it as possible. Because what we don't know is pretty extraordinary. And the more that you educate yourself, the more that you read, the more you understand what's possible. And if you read the histories of very famous people like a Mandela, for example, Martin Luther King, FDR, Gandhi, you read their stories, it's very humbling. And for me, I'm how do I put this in the right way? I just love doing things that help other people, and I'm always driven to try to take advantage of every opportunity I can to do the right thing. So when I was working on the docks, I enjoyed it. I had a great time, but I never saw that as the end. When I worked in government, I thought it was great. It was the best learning experience of my life, but I never thought it was the end. Everything is a stepping stone. What I'm doing today, is it the end? No, because I think we can become so much better 10 years from now. So I see my job today is to how to set this organization up so whoever comes after me can dramatically improve it. But you set the foundation. So I like building, and I like being challenged, and I'm very optimistic by nature. I don't see anything that can stop you from being successful. It's like if you play sports and you're down a few points with 3 minutes to go, does not mean you've lost. You can still win. So you have to have that determination and grit. It's like resilience. You got to be resilient. Crappy things happen, suck it up, get up in the morning, look in the mirror and say, boy, I'm alive today. It's a wonderful day outside. I can do good things today. Forget tomorrow, forget yesterday. Something happened yesterday, I'm much to forget. Let me focus on today, and then tonight, let me focus on tomorrow.
All right. Well, on the topic of talking about the future, what do you think about the future of medicine? What do you think it looks like, even pre-COVID, post-COVID? Where do you see it going?
Well, I think that we have to redefine health. And we're in the treatment business, despite all of the entities that we have, and it is true for almost all organizations. We do very, very well at taking care of people after they have a problem. I think the holy grail here is that if we can become as good at preventing illness as we are at treating it, we will have made major headway. And it doesn't mean that we do all of this by ourselves. It has been what kind of a catalyst can we become in helping to change lifestyle, helping to improve the food supply, for example, helping to make sure that we promote nutrition and exercise, helping, for example, COVID displayed something phenomenal, which we've all known, but it became very evident with COVID, is that there are communities that are unbelievably disproportionately negatively affected. So how do we deal with that? I mean, you have minority communities that do not have in any way the accessibility or the care that we would take for granted. And what do we do in that regard? But if we call ourselves a health system, my dream would be that we become a health system, that we're in, because health is more than the provision of medical care. And if we can become a true healthcare system, so we're as good at the front end as well at the back end, I think that would be the dream. And that's what I hope that we will begin to make major headway on over the next couple of years.
Right. What would you say is the most rewarding moment in your academic and professional career?
The most rewarding? Well, I would say every day, but the experience I had working with the governor in the state of New York was, to me, and this is why I said at the beginning that everybody should take the opportunity to work in government if you can, despite what people say about it sometimes. But when I remember when I working with the governor, when I used to have to go to the homeless shelters and go to the crack centers and deal with child abuse and spouse abuse. You realize, the underbelly of society that exists, and it opens your eyes as your responsibility and obligation to do something about it. I saw, despite the fact that I grew up in poverty, what I saw and what I was directly engaged in was something that just broadened my perspective completely. And unfortunately, an awful lot of people don't see this and don't know it. And sometimes my wife will say, well, that's all negative, but I think it's important to see the negative so you can appreciate the positive. So that experience in government and being able to have your hands in everything gives you a very, very broad perspective about life and about people and about the possibilities. So I think the experience working with the governor he was a phenomenal guy to work with. He threw me into the fire. He gave me responsibility in areas I had no experience in at all. And he said, "You're in charge." And I'm thinking, I'd go home thinking to myself, my God, I know nothing about this area. But when you're under pressure, you learn very fast. And I believe very strongly in throwing people into the deep end of the pool. You will learn how to swim quicker than if you dabble in the children's pool. So that to me was the most exhilarating experience and eye-opening, and I recall it almost on a daily basis.
We got so many questions pouring in. Josh, are you looking through this still?
Yeah, I am. I'm trying to keep up with that.
Someone asked, how do you establish a system-wide culture from the top down? You're overseeing 23 hospitals now, and trying to keep a consistent culture through each one must be challenging.
Well, we've got 73,000 employees. There's many ways, one is having a vision about what you're all about. We're about improving the lives of people. That has to be a constant. You've got to make sure that message is continually given. But I would say the one thing that you've got to do to maintain the culture, and because that's the personality of the organization, is make sure you bring into your organization in the various leadership areas the right people. I spend an awful lot of time looking at the people we bring into the organization. If I bring in people that are team focused, that are not interested just in themselves, but are interested in what's good for the organization and what's good for the community. You bring in people that are collaborative, you put them in the right positions, you will maintain your culture. Equally, if you have bad people in your organization that are only doing things for their own self-aggrandizement, then those people need to be taken out of the organization. It's like if you ask me, how do I have a nice, neat garden without weeds? It means I got to weed the garden ever so often. You got to pull the weeds and get rid of them. And then the good grow. It's the same with an organization. You got to take out the weeds. So it's all about the people. And one last point, as you guys know, for the last 21 years, although it has got disrupted with COVID over the last couple of months, for the last 21 years, I have been meeting with every single new employee that is hired in the organization. So for 21 years, for 3 hours every Monday morning, and we hire about 200 people a week, I meet all 200. And I spend hours with them. I've been doing it every Monday. Why is that? One is it's important for them to know that the leadership cares about them. It's important for them to know that, for them to understand what we're about, for them to understand the vision and the values. And for them to understand that even if they're working in the laundry, they are an important component of the organization, and they're part of the value system and part of the culture. And I think that has been a distinguishing characteristic of our organization, that constant communication with everybody in the organization at every level. We all have major roles to play. The mistake organizations make is thinking that it all evolves and succeeds in the C-suite. That is not true. We are here in the C-suite to make sure everybody else can maximize their talent and their compassion and their dedication. But to me, it's pick the right people, spend your time picking the right people that can work together, and you maintain the culture.
There's a great question here about, does being born into poverty drive you to work towards making a more just healthcare system, considering the impact of how expensive care can be on people in low socioeconomic groups?
Oh, absolutely. We're all influenced by our backgrounds. You don't ever, get away from your background unless you purposely decide to do so. But for example, I give this little, example. I get very upset if I go into a restaurant with a person, and I've had this experience, and the person is a CEO of something, or he's an executive someplace, and they treat the waitress poorly. they kind of speak, you know, in a nasty way to the waitress, or they're impatient when the waitress just doesn't do what they want. You know, I feel like punching the guy in the nose. Like, you know, knock the crap off, you know, that she's here or he's here trying to make a living, do the best they can, you know, be decent, you know, just be decent to people. You know, when I grew up very poor in Ireland, you know, we were treated poorly because it was very kind of a, you know, high class and lower class society. And I was recoil against that. And as I said, my great equalizer was on the playing field. Because when I got those guys on the playing field, it was fair game. I mean, but so I always, you know, be a human being, be a regular person. You know, you have a big title, who cares? You know, everybody puts on their pants in the morning the same way. We'll all end up in the same place or someplace, you know, and, you know, you travel your journey, you're on a journey from birth to death, a relatively short period of time, make it matter. You know, don't get too high on yourself, you know, and just treat people at all levels. You know, some of us are more fortunate than others. Some of us have benefit from better looks than others. Some of us have backgrounds different from others, but try to stay basically human. So yes, David, the background definitely influence.
You guys want to keep going? I can pick a few if you want, Josh.
Well, I'm just curious if you feel like that those two mentalities are a little bit, if they can coexist, right? If you can be ambitious and, you know, want to be the best at something, as well as understand that everyone needs to be treated and, you know, equally and respect everyone.
Oh, I think that part of being the best is to try to make everybody around it the best that they can be. You know, everybody, you know, not everybody gets to the end of the race the same place, but you can help those, you know, around you to be not competitive to the point where you're cutthroat competitive, not being competitive to the point where you're narcissistic and it's just about you, but make everybody around you a little bit better. You know, influence. Leadership is at the end of the day about influence. It's about now, it's not about control. It's about not directing people. It's about influence. It's about, you know, by your example, do you motivate somebody to do something different or better? And can you open doors for people? I mean, I like doing that. Can you open doors for people? You're doing this, by the way, with this program. You do it with your program. You're opening doors. That's what you're doing. You're getting people that are listening saying, oh my God, I can do this. If people walk away from this meeting saying, oh, there's an opportunity here. I can do something. I can improve. I can do this. I can raise the bar. Then you've provided more access to opportunity. That's what you're doing, providing access to opportunity. Now, if you're a CEO and you're a jerk and nobody wants to deal with you and they despise you, you don't have influence. You may think you're important, but I have no time for those kinds of people.
It's interesting.
What you do for others that matter. It's not just what you do for yourself.
This was the reason for the Netflix show, to be influential and to influence young people. And I think that you've done that today, and this course allows us to do it even more. And I think the reactions we're getting are extraordinary, the impact that you've had in this group so far. I think they were still asking for your book list. One question is, who influenced you the most? Who's the inspiration? These are softball questions, but that's, you know, I'd like to know that myself. Like, you know, because we're all influenced by, you can't just invent, you've invented who your persona, but who influenced you the most?
The person that influenced me the most was my mother. She was a person that always said something like the following. She said, don't ever let your circumstance limit your opportunity. She always said, read, learn, explore. I read Shakespeare as a kid. I read the speeches of Churchill as a kid because my mother, and I don't know how, she found those books. So through the books, I got to look into another world. My father was very different. My father was critical of me for even wanting to go to school. But my mother said, learn. So that's why I love books. My mother loved books. I love learning and reading. That's just why I hand out books to staff all the time, as you know. I mean, every quarter I send out to all my senior leadership a couple of hundred, a dozen, 2 dozen books that I've read that people, and it's not on healthcare necessarily, some of them are, but explore, expand your mind. Don't get caught in the silo. And these are books that you should read. So my mother, the governor, as I mentioned, and there was another guy that worked with me years ago when I worked with another organization, see a guy named Dr. Birch, similarly. But you need people around you. The greatest thing you can do is to open the doors for somebody else. And it's not a physical thing. It can be demonstrate to people that there is a possibility there. You can go grab it and then help people along the way. That's a great gift to be able to give to other people. And I have a memoir coming out in the fall. I mean, I wrote a book about my story, which I never really wanted to do, but I kept getting people urging me to do it, and I had publishers wanting me to do it, so I did it. It'll come out in end of September, and it'll tell more about this story. But it's not about just going. It's not just about me. It's about what's possible, and you got to believe that you got to have all of you here that you guys, David, and I know your story a little bit as well. People, open doors for you and influence you to take advantage of what's possible. And that's what you're doing with this course. And I would say to people out there that might be in difficult financial circumstances or family circumstances, don't let that inhibit you. You may have to do certain things to get around it or over it or do it, but keep your eye on the ball. Look long term.
So coming right now, it says this program has already done so much for rejuvenating my passion and desire to contribute to healthcare, but today's session is icing on the top. I kind of feel the same way. Thank you. It's so good.
Thank you, guys. It's great.
We have like 3 more minutes. Josh, you want to pick your top 3 favorites? And then Josh, you'll get the Mike's book list we'll make sure you get that. You can send to the group, okay?
And by the way, the COVID book, we wrote a COVID book. It's coming out today.
People are asking what's your all-time favorite book. Do you have a number 1 book that you'd recommend to them?
The all-time favorite book. It's the book. The Building of the Brooklyn Bridge would be one of them off the top of my head. The Building of the Brooklyn Bridge, and another book on the life of Robert Moses. I mean, if you think about the guys that thought about building the Brooklyn Bridge at the beginning, just think of it. I mean, just think of the time and what they created. It was extraordinary.
Mike, the one book you told me once was The Immortal Irishman.
Oh, The Immortal Irishman, yes, by a guy named Maher, who was regarded as a revolutionary in Ireland. He was picked up by the English. He was sent to Australia. He was a so-called criminal. He was imprisoned in Australia. He actually escaped from Australia, which, by the way, makes you wonder, how the hell do you escape from Australia? He escaped from Australia. He comes to New York, became very active in New York, became a friend of Lincoln, became a founder of the 69 Regiment that became the famous Irish regiment that fought in the Civil War, moved out west and became governor of Montana. So, when you read stories like that, you say to yourself, I haven't done anything. It's perspective. I mean, like what reading the book thinking, oh my God, how the heck did he do this? But these are the stories that motivate. But we can send out, I have long lists I have hundreds of books that I've sent out over the years, and I can get these to you, David. You can share them with everybody. Okay.
Great. We ended up with almost 1,800 participants. A lot of people are getting on late and felt like they missed out. So this is available on YouTube. Josh will publish the link. All the talks are available on YouTube. This is clearly one of the better ones. And we're just getting an outpouring of thank yous and appreciation. And as you always inspire your audience, Michael, thank you for taking your time. Randy, Joshua, you have any last thoughts before we let him go?
you want to give any last advice? We have a lot of high school, college students, med students. Give any advice to them where they are in their position?
We could go for another hour.
I would say to everybody that just I'll say what my mother said to me over and over again. Don't let your circumstance inhibit your opportunity. Wherever you are, you can do something about it. Do not play victim.